Hey guys, welcome to this week's podcast episode. And I've got a fantastic guest for you today, a sleep specialist, Dr. Bijoy John, coming out of Tennessee. And he's board certified. And he's going to talk to us all about better sleep habits, better sleep hygiene, and how sleep is our superpower. I'm really happy to have an expert, medical expert on the show, and happy to welcome him. So, Dr. John, welcome.
Thanks, Chris. Appreciate being on your show. I mean, you said it. Sleep is the superpower, right? It's within all of us. But the challenge here is people don't recognize that. So people don't utilize the fullest extent of the power they can unleash by just sleeping better, right? So we focus on fitness, we focus on diet, we focus on working hard, we hustle culture, but we'll be better versions of ourselves if we sleep better. Through my own perils as a med student and starting a business and losing my loved one, I had my own problems, but I overcome all that, and I have developed the 7 proven sleep strategies for better health and happiness. It has taken me 25 years to perfect it. So I do this on a daily basis. And my mission is to share it with the world. So that's why I decided to write a book and come on podcasts with experts like you and to reach more people.
Yes, I love that. And there's nothing better than, you've had just like a grueling day or week, traveling, or work, whatever. And then you just like you can go to like this calm, peaceful, just like really cold environment and just crash and just get rejuvenated. It's the best feeling. So, the kind of question is there's a book by Ariana Huffington that kind of before this sleep revolution. And so, talk about just kind of like the first thing is the correlation between sleep and mental health, and we'll talk about relationships and all of that.
So great. Ariana is a great advocate for sleep. So for me, it's, what I share in my book is the personal journey and the real life experience as a physician. I take care of real people, real problems, find a real solution. So the practical methods. So it's a huge topic, sleep and mental health. See, Chris, when you have a problem in our lives, what do we say? We say, let's sleep on it, right? Nobody says, let's work out on it or let's diet on it. So we know the power of healing in our sleep. So, the sleep and mental health have a bi directional relationship. The less you sleep or the poorer you sleep, the worse your mental health is. And the worse your mental health is, the worse the sleep is. So it's a vicious cycle. So I believe just by improving your sleep and healing your sleep, by improving your sleep quality, your symptoms of anxiety and depression can be better. So that's why I dedicate a chapter for this particular topic. It's huge.
Yeah. And kind of moving forward, just kind of common sleep issues, because for example, like my wife, she's very light sleeper, and just like certain areas, like certain cities, she can sleep great. And then, because we're in Texas, so certain cities, she doesn't sleep as great. So what are some common sleep issues? Also, some very surprising or lesser known causes of sleep dysfunction that you've discovered.
Great, great question. Women actually don't sleep better for many reasons, right? They're the nurturers by default, caregivers, and they worry, they carry the burden. So that's why I said I'm going to dedicate a chapter to women. So I've taken all the high points of my experience. So to answer the question, why does she not sleep in certain cities? It's interesting. The hormone that puts us to sleep, melatonin, is actually optimally secreted in colder temperatures, right? So when you go to this warm climate or a tropical vacation, you don't sleep better. So it has a lot with do with temperature. So the common sleep problems that I see are insomnia, meaning I cannot go to sleep, or I wake up, or I cannot maintain my sleep. You wake up in the middle of the night. So the other major problem that I see is sleep apnea, right? That we have to talk about that. And so then there is this other problem. Sometimes people sleep too much. That's called hypersomnia. So either you don't sleep or you sleep too much. So those are the two main complaints people come and see me, or of course, snoring associated with sleep apnea. So
Yeah. Yeah, and then snoring, which is interesting, is the because is that something to be concerned about? Should people not be snoring a lot, or is like light snoring or heavy snoring? What is this? What is this symbolic of?
Snoring, so it means when you snore, that means you have an obstruction. So imagine a pipe and then you're flowing water and the pipe is narrowed, then it causes turbulence. Same thing with air. When the air passage gets narrowed, that's the turbulence of snoring. Men actually snore more because our larynx is bigger. So our voice box and the windpipe system is like a trumpet. So the bottom is bigger, the larynx is bigger, so our voice gets amplified. So men snore more. Women actually are narrow, or smaller larynx, so they're not amplified. So we have to be careful. So if you have snoring, even in children, in children it's a little bit easier. It's a tonsils. Both my children had snoring and sleep apnea. I took out the tonsils. They get better. Adults, it's the tongue and the posterior pharynx. Everything collapses. So it's a little bit more complicated in adults. So, but to answer your question, when somebody snores, you have to address it because it's a clear sign that something is blocking.
Yeah, and we'll talk about technology and how to address these. The next question, if people listening to this love doctors and, just entrepreneurs and they want to improve their sleep, what immediate steps can they take if they're struggling to get good night's sleep or, just improve their overall sleep hygiene?
Great question. So I in my book's called Nobody's Sleeping. The subtitle is the 7 proven sleep strategies. So I went a step further and I actually formed an acronym for that. If your viewers are listening, they can take it down. It's called Sleep Now. SLEEPNOW. Right? Sleep Now. So the first is schedule. For any plan to succeed, we have to have a schedule. So I tell everybody who come to me for sleep problems, say we have to have a schedule. I dedicated 10 p.m. to 6 a.m. For sleeping because that's the only way you're going to get all the stages and cycles. The non-REM sleep is earlier in the night, so 10 p.m. So that's why going to bed a little bit earlier is important, and we have more REM sleep or REM sleep towards the morning. So 10 p.m. to 6 a.m. is excellent. The next is the L in the acronym: low light, low noise, low temperature. The melatonin, the human hormone that puts us to sleep, we have our own. There's no need to take anything from the no. We provide how to tap it. So low light. The word mela is darkness. Melatonin is only secreted in darkness. And I talked to you a little bit about the situation with temperature. It is actually optimally secreted at a lower temperature. Of course, noise is an irritant and annoying. You can't sleep. So that's the L. And then the next is E is the electronics. I tell people to get off electronics at least an hour, but practically at least 30 minutes prior. The light from the phone, especially in your bedroom where there's no ambient light, tells the brain, hey, it's still daytime. There's no need to go to sleep. Remember, melatonin only secretes in darkness, right? And not to mention, all the notifications, the dings, and then, we all wake up because our sleep cycles are altering. Then when you have an access to your phone, you look at the time, then it's 3 o'clock, it's only 3 o'clock. So all those baggage that comes with the phone. So I keep my phone away, 6 feet away from me, and in my bathroom, I set an alarm. So the going on the acronym, the next is E in the acronym. Exercise. The exercise is great. We're having a lot of research saying exercise helps to sleep, but the timing of the exercise, the end product of exercise is heat and also cortisol. What happens is that, like I mentioned, the higher core body temperature does not help us to sleep. And most people, there are some people it helps. So we can't generalize the rule. For me, if I exercise close to bed, and like majority of the people, we don't sleep. So I tell people to exercise at least ideally 4 hours, but at least we should be done exercising at least 2 hours prior to going to sleep. So then the next is P in the acronym, SLEEP. P is powering off your mind. So we can only power off your mind by doing the other things, having the bedroom cool, having a comfortable mattress, not having your phone. And I teach 2 techniques for people. That's the first technique, how you power off your mind, is by something called vivid imagination. I have been using this technique for almost 30 years. When I lay in bed, I don't take my reality into bed. I actually think about the last show I saw the movie or something. I become the director, and I started using my own imagination how the movie will end or what I do. So I'm not taking my reality. And the next the technique is yoga nidra. So I teach people to lay on their backs and with the palms up and looking up to the ceiling and just letting go. Nidra means nothingness, right? This is an ancient art, and you start if you want to think about something, you can start focusing on your scalp muscle, the facial muscles, the neck muscles, the chest muscles, the abdomen, and then it's like a scan. It's part of the cognitive behavioral therapy. So so that's how you power off your mind. And going back in the acronym, NO is no to worries. Remember, we cannot worry in our bed. So we are all born to worry. So I tell people to worry between 6 p.m. and 8 p.m. And from 8 p.m. on, you are getting ready to go to sleep. So I was getting ready for your show yesterday. I was looking what time, the time difference. We are in different time zones. I got everything organized, and I'm done. I don't think about it in night. Hey, I'm not going to jump on my phone. And so that's how no to worries. And then the W is win by losing. See, we want to win, 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 but in sleep, you have to be easy. By the time people come and see me, there are many, many rituals, right? I try to unravel all that, unmask all that. Keep your, simple. Bedroom is only for, sex and sleeping. Most people are snoring or worrying. So I keep it simple. So this is where you win by losing or keeping your schedule simple. So that's the acronym SLEEPNOW, schedule or light. No to electronics, no to exercise 4 hours prior, powering off your mind, no to worries, and win by losing yourself. And I tell people the practical way I approach is the entrance to your bedroom is like a TSA screening machine. So if you have your phone with you, beep, you got to leave it out, right? If you're bringing your worries with you, beep, you got to leave it out. So you're entering this sacred place just for, relaxing and going to bed. So that's why I tell, prepare, that's why I coach people, I teach people, and I've written that all in my book. So thanks for the time to explain all that.
Yeah, no, it's quite interesting because it brought up so many different, because like a lot of because people love to sit on their bed and work on their laptop, and that's kind of discouraged because then you're associating work with your bed. And the other thing is, for a lot of residents listening to this, and we all know the rigors of residency, and you're up like 30 hours, 48 hours, sometimes even, extended periods. How do you combat this? Because obviously it's detrimental to your health. You gain weight, high cortisol, all this stuff, mental health. So how does a resident kind of use these in their very grueling schedule?
Yeah, throughout residency, fellowship, as an attending ICU doctor for 25 years, I was a perfect example. We did the leapfrog, or we stayed in the ICU for like long shifts.
Yeah.
So I found myself the way to sleep better. So somewhere along the line between 12 midnight and 4, I always dedicated a time to go to sleep. That was my focus even on the busiest days of call. We used to do 36 hours of schedule. I did that for like 25 years. So somehow I prioritized, but not possible, because if you have an emergency at 2 a.m., you have to. But most of the time, you try to focus. So I make sure I finish everything, all the orders, organize everything, whatever the admissions, I'm done everything till. But it was 50-50, but at least I tried. So then what I do is, when I get a chance, that when there is a low point, in the hospital, when you get a chance, I actually practice power naps. So that's how that was my big strategies to any chance I get. If I'm on a shift or something, I just go to my call room and I just try to have a power nap, maybe 5 minutes, 15 minutes. So that's how I survived it, because you have that surge. You get into a little bit deeper sleep if you're sleep deprived. And so frankly, all people who do shift workers are sleep deprived. So we have to be very careful. And I was very careful going back home. I was very careful about making decisions. When in doubt, I always got help from others. I never made big decisions by myself. I was not embarrassed to ask help, because you are at risk for errors. So that's how I survived. And then the next day I slept. I made up. So what happened? be candid, we are all sleep deprived when you are in the battle. So, a couple of ways: prioritize sleep if you can between 12 midnight and 4 a.m., and also try to get power naps. And you touched the important point about weight gain and shift workers. So, more time you're awake, the more chance you have a tendency to grab food. And of course, you're going to grab the high glycemic food, chips, sodas, and that's going to gain, weight. And of course, when you don't sleep well, the ghrelin and leptin ratios are, altered. We tend to secrete more ghrelin and less leptin. Leptin is, appetite suppressing. Ghrelin is appetite promoting. So, and high cortisol. You mentioned all that. So you have to be very careful. So the best advice I give people is whenever you can get rid of the shift work, please have it in your back of your mind. To survive residency fellowship, you have to. But when you get a chance to get off that, I strongly encourage people to get off shift work if you can.
Yeah. Yeah. I just remember just, being on call and just like could be called at any second. So it's hard
Yes.
to like take it, it's like you just walk down the hallway and all of a sudden you get called back and it's like it's just this constant like uncertainty. But
Yeah.
you mentioned what's interesting is the role of technology in sleep. And so what's you mentioned low noise, low light. I always carry around these heavy duty noise blockers just because
Correct.
and then like sleep masks. But how does what other technology or things people can use to enhance or better their sleep?
So it's great. The bedroom is so you have to have a comfortable mattress. The role of the mattress is to, if you have back pain or neck pain, to adjust those pressure points. So because when pain hinders sleep, so that's the role of the mattress. So make sure you have a comfortable mattress, the low temperature, and then I'm a fan of noise canceling machines. So in fact, I do have one in my own bedroom, and also lavender is in a little bit of aromatherapy that helps. So all the senses, all the senses are calmer. What you're breathing, what you're feeling, and plus the seven strategies that I made. So it's a multitude. Not to have access to your technology around you. See, Chris, we have met our match in the hustle culture, right? Hustle, 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 and we want the sleep to be like an on and off switch, like anything else. But sleep is a little bit different. It is met as match. Sleep is just the opposite of a hustle culture. You have to work around it. You have to slowly, wean towards it or gravitate towards. You can't just rush it. Like the dimmer switch. It's like a dimmer switch. We want an on and off switch, but unfortunately, sleep is one ancient art. It is spiritual. It is met as match. So it's the yin and the yang. We need this to be better at that, right? So that's what I preach.
Yeah, yeah, I love that. So talk about I'm always interested in future trends, and we have around 5, 6 minutes.
Yeah.
What do you see the future trends in sleep medicine and treatment? Anything new? Because you're on the forefront, in the healthcare field.
Yeah, there's a lot of new technology about something on your scalp to stimulate the non-REM sleep. I'm actually curious to know how that's going to work because it's changing the electrical field. You wear this, that's a lot of research is being done on it, but I'll be eager to know because we are all different. Even the frequencies and everything is going to affect how we're going to have that. And I really believe we cannot data mine our way, we cannot technologize our way into sleep. I am on the other corner. I think sleep is natural. I think anything external, we are product of the devices. We don't want any of the devices. So a lot of technology is coming. And I'm particularly fascinated about this thing, technology or not technology, the finding that your muscles are secreting chemicals. We always thought chemicals in your brain to sleep, but there's this new data coming out from animal studies where the muscles are secreting. So we always know the laborers slept better. So I'm more excited, which muscles, maybe we need to do that muscles prior to going to sleep. I'm thinking it's probably the thigh muscles. So I'm excited about more than technology. Unfortunately, I'm not a big fan of technology because people come to me all the time wearing all the devices, and I have less REM sleep. I have less R. So people worry about it. Even in weight loss, what do you tell people? Hey, you cannot weigh yourself every day. You weigh yourself, do the action, and then 6 weeks, 8 weeks. But here, the data, everybody is so obsessed with the data. The more you worry, you're going to be less sleep. So I tell people to get the data, implement, and then see what happens, not on a daily basis. So I'm on that corner, fortunately or unfortunately, on the side of less technology because you have it within you. You don't need anything else to do.
Yeah, yeah. Yeah, I love that. If people want to contact you and follow you and reach out to you and find out more about what you do, and because I know you have a book, and then I know you have a sleep academy as well, which is interesting. How can they find you and follow you?
Right, great. So my book's called Nobody's Sleeping. It's available on all the platforms. The 7 proven sleep strategies. It was the best seller for new releases on sleep. I released in March, so I'm excited about that. It's doing well. I also have a academy called Sleep Fix Academy. Whatever I taught, people can take the course. It's a 6 weeks course. And there's some podcasts and some other resources that I have on my website, and I'm all on and all the social platforms as Dr. Sleep Fix on Instagram and Facebook and LinkedIn. And,
Yeah,
so I am Sleep Fix, and my website's called Sleep Fix Academy. So my
yeah, I
aim
love
is
that.
aim is to teach people how to sleep and to be the best version because I suffered from it. I've discovered it. I was there and a shift worker, all kinds of things. I've been in the middle of it. And in fact, I do have sleep apnea, which I treat myself. So I am there, I have experience with all my patients. I share all those stories. So, I want to empower people. That's my long-term goal.
Yeah, yeah, I love that. This conversation reminds me of those 48 hours on call, just and then just kind of the sleep that took me a month to recover from sleep deficits, sometimes. So, but I really enjoyed this conversation, and I love your acronyms, and I love how you're using your expertise to help others. And for the audience, please give Dr. John's socials a like and follow. Check out his book, check out his Sleep Fix Academy, and thanks so much for coming on.
Thank you, Chris. It was my pleasure.